Well, good afternoon, everyone, and welcome to the first webinar of 2025, which was also specifically requested by you guys, which is Next Level Ergonomics and Advanced Programs to Transform Workplace Health. So my name is Holly Foxworth. I'm a registered nurse. I'm also the Director of Marketing Communications here at Axiom, and it's really a pleasure to have all of you here today. As you know, ergonomic injuries, we sometimes refer to them as the silent erosion within your workplace because they're kind of gradually gearing down and your employee health, productivity, a lot of times without detection or intervention. So that's exactly what we're covering here today. We're going to talk about the complexities of ergonomics and introduce you to some of those advanced methods to effectively address them. We have put together a panel today of experts to walk you through this. And so that includes Dr. Cherry, who is our Chief Medical Officer. He's going to talk us through the impact of musculoskeletal disorders and traditional ergonomic approaches. Then we have Dr. Marley. He's a guest speaker. And so he is actually an ergonomist and sports medicine doctor of physical therapy. And he's going to discuss modern ergonomic practices and strategies along with how it is that you can create some effective plans. He's also going to share some real life success stories. And then we have Dara that's going to talk you through how it is. Dara's our Chief Marketing Officer, might I mention, and she's going to talk you through some actionable steps on how you can align your stakeholders, how you can talk to them about putting together an effective ROI. That way that they understand the importance here and you can really get a program up and running. So you will meet them shortly, but before we get to that, just a few notes to mention here. Here on your platform, as you notice, every year we always start out. We talk about ocean record keeping is one of the things that's top of mind as we go into January. So that is exactly what we're going to be covering in February. That's going to be our next webinar, and so. The title for that one is Advanced OSHA Record Keeping Workshop and how it is that you can avoid costly mistakes in 2025. So that'll be February the 6th, and we'll have that at 1:00 p.m. Central. To reserve your seat, all you need to do is look there on the right-hand side of your screen. You'll see a purple box with a blue box at the bottom of it that should say RSVP. You'll just click that button, and that will directly get you signed up. You don't have to enter any additional information. It will send you a calendar invite. I will tell you that we did a version of this last year, and it was one of our most requested events and follow-up that we had a lot of feedback on, especially some of the tricky scenarios, the record-keeping scenarios that we've given you guys. So I can assure you that you will learn a lot. You'll walk away with a lot of great information that you can not only use yourself, but also share with your teams. As always, we have the session that's recorded, and so that will be made available to you. It's usually within 24 hours of us completing the webinar here. We'll send that out to you, but also in addition to that, you can have access to the slides that we're going to be going through today. That's located there at the bottom of your screen. You'll see presentation slides, and then below it are some helpful blogs, some helpful supporting blogs that are there. And then finally, engagement. I know you guys hear me say that a lot, but that really is important to us, and that's really what's built this large webinar community. So we like to hear everything from you. We like for you to participate in the Q&A chat. We like for you to participate in the polls that we put out there. That Q&A chat is really a big thing with us. We give out a lot of great gifts, and that's the first place that I go whenever I go looking for people to send gifts to. So be sure and use that Q&A chat box that's located there at the bottom of your screen. You can tell us, have you had musculoskeletal injuries at your facility, or what type of ergonomic program you have, or do you have a question, do you have a tip, anything like that, you're welcome to share there. There's no wrong answers. There's no bad questions. Anything you want to share would be great, and we'd love to have that from you. So with that being said, I am going to let you meet some of our speakers today. Dr. Cherry, let's start with you, and then we'll go to Dara next, followed by Dr. Marley.
Thank you, Holly. My name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer. My professional background is I'm board certified in preventive medicine, public health, and occupational environmental medicine. And I've been supporting the military, corporate, and industrial operations for the past 20 years, and it's a pleasure to be with you.
Awesome. Thank you. Dara?
Thank you, Holly. Great to see everybody. Happy New Year. I'm really excited to have this topic today. I think Holly said this, but our clients have asked for this topic. So it is something that we really pride ourselves on is listening to all of you. So if you have a topic or you want to talk about something, let us know and we'll pull some experts together and have a great conversation. And Holly really does like giving presents out. So please participate. And we hope to have a really nice conversation today. Thank you all for joining.
Awesome. Thank you, Dara. And Dr. Marley?
Hi, everyone. So I just want to thank Holly and Axiom for allowing me to join. Definitely look forward to conversing with you guys and answering any questions. As you can see, I'm an injury prevention specialist and ergonomist, also a sports medicine physical therapist by trade. So I've worked with a variety of people, many different ages. Definitely been honing in on more work-related injuries, workers' compensation claims, and also just preventing those injuries with some of the stuff that we're going to talk about today. So thank you guys for having me and look forward to talking to you guys.
Fantastic. Well, thank you for joining us, all of you. And should you want to reach out to Dr. Marley directly, if you have any questions for him as the specialist, you can always find his contact information located there in the speaker bios. It should be on the left-hand side of your screen. So you're welcome to do that as well. So in terms of what we're going to be going through here today, we're going to talk about understanding some of those ergonomic injuries. We're going to talk about changes in some of the ergonomic methods, some both traditional and modern. We're going to talk about creating effective plans for your ergonomics, and then some real life success stories followed by how it is that you can start a successful program. So we're going to start out with Dr. Cherry, and Dr. Cherry, talk us through, actually, I take that back. Before we get into that, let's take the poll here and tell us how significant are those ergonomic injuries in your facility, there within your organization. Are they not significant? Would you say they're moderately significant, very significant, or unsure? And you're welcome to not only use the poll, but if you have something that you want to add there in the chat box, that's great as well. And then we'll look at the answers that you can compare those on how you would answer that to those that are also in the audience to kind of see where you say in there. Dr. Cherry, while they're doing that, talk us through musculoskeletal disorders and the impact that they have.
Certainly. Thanks, Holly. And I think we've kind of addressed this in other highlights in previous webinars where musculoskeletal injuries are really a very common type of injury, a very common type of nature of injury we see in personal injuries and in work-related injuries. You know, regarding ergonomics, though, I think it's very subtle. You know, in many ways, these ergonomic injuries are like hidden leaks that are kind of are stealthily coming into the company's finances and creating a lot of small drips that lead to significant losses over time with regard to lost work time, direct medical costs, indirect costs, things like that. You can think of it as kind of a risk assessment where we kind of tend to focus on severe things, which may not happen very frequently, but there can be many ergonomic injuries that are not very apparent to an organization, but they can be very frequent. So, you know, here's some of the statistics showing that musculoskeletal disorders are about 1/3 of all of worker injuries and illnesses, and reporting over 300,000 cases per year. And about 1/3 of those cases actually have days away from work. So that's a really important performance metric that we look at about tracking how injuries are categorized. And then the costs are significant. Direct cost, over 160 billion. And I always try to replay some of these big numbers. Like once we get over 1 million, I hear billion or trillion, I need to rethink what that means. So 1 billion is 1,000 million. So you're talking lots and lots of money here. And, you know, again, ergonomics can be very common, but not on people's radar. So it's really important to focus proactively on.
Mm-hmm. Dr. Cherry, just to mention, we've already had some great points that have came in. Joseph had said that this specific course had caught his attention because they've had several musculoskeletal incidents last year, resulting in some high number of days off from their office. And so they're looking for some good talking points to address in 2025. Jeff had also said that, that some of their injuries are infrequent there, but when they do happen, they can be really time consuming and result in a lost time. So I definitely agree with those, and I'm sure you do as well. All right, let's talk about the traditional approaches. Kind of what I take that back. These slides are kind of wonky here, but anyways, in terms of what you guys had answered, and so you can kind of see where you compare, it looks like that they're pretty close for the non-significant and unsure there, but those two in the middle are really what jump out at me about the moderately significant. So I think that, or Cherry, would you say that that would be what you would anticipate as well, or what would you expect?
Were you asking me, Holly? Sorry.
Yeah. Would you? Is that? Do these numbers?
As I think through the answers, I think people may be using different metrics. Right? Is moderate and very significant, meaning one severe case, or based on frequency. So. I think if we actually looked at it across both, if we kind of dove into the nuance of that, I think it would be fairly significant for most organizations, and it, again, a lot of these injuries are more subtle, so it's below the radar. But I'm glad our audience, sometimes our audience is fully aligned with our philosophy here. So it makes me realize they're very sensitive to this.
Absolutely. Dr. Marley, would you agree as well? What do you see on your end?
So there are sometimes a lot of those injuries that kind of just fly under the radar, whether it's being underreported, excuse me, or things of that nature. Like I said, since I've been contracted with various companies, that's one thing that we've noticed and uncovered, that there's a lot of employees that kind of just say, oh, it's part of the job to have some of this soreness, and they kind of fight through it and they don't really report it. So we don't really know on the company's end. But yeah, I would definitely say moderately significant to very significant are the two that I would expect to stick out more so.
Yeah. Tim was asking if that is the level of your metric, then mine is not significant. Okay. Well, thank you for sharing that, Tim. Well, Dr. Sherry, talk to us about the traditional approaches, what we tend to think of when we use the term ergonomics.
Right, and I actually looked up some of the history of ergonomics, and at least in America, and it was interesting to see ergonomics kind of go back to kind of World War II with the military, looking at helping persons actually perform well under stress and under less than ideal environments and very stressful events. But I think the way we think of ergonomics didn't really appear until the 80s or 90s. And I was actually enlisted in the Navy in the early 90s. And I remember ergonomics being rolled out to one of our clinics that I was working at. And it still felt very subtle in the sense of it being like a proactive measure where it wasn't really customized. It was kind of like, we have some money to spend on, certain things like desks or adjustable, monitors, or, just very rigid in that sense. So, I think things have evolved over the decades, but back then the traditional ergonomic approach had very limited customization with a one-size-fits-all. Most programs are really reactive. So resources were, once you were injured, then you could kind of seek resources. I've seen programs where you couldn't get resources until a workers' comp claim was actually filed. So that really has some, terrible implications from a preventive medicine perspective, even if it's secondary or tertiary prevention. And really they only focus on physical factors. And as we've been talking about on our webinars for now a few years, really having a holistic approach of health is mental health and physical health together with very little boundary in between.
Dr. Cherry, where does the problem come up whenever you think of just ergonomics with these traditional approaches that are here? Where do we run into a problem?
Well, one of the biggest things I've seen is when you look at a large company, they have so many different types of workers. They have people in the field, people doing safety sensitive work, people doing very physically demanding work, and then they have people in the office doing sedentary work. So the risks are dramatically different. And I think sometimes one group is not focused on, others are. Sometimes it's just based on a trend, perhaps, and it's not based on what's the needs of the employee population at that time. And it can change over time as even the same employee in the same job, as they work for years, their needs may change. So I think it's really being able to customize and be more proactive is really the kind of the some of the negatives that are kind of in that traditional ergonomic approach. I think a lot of times us in healthcare, especially occupational health, we kind of get it, but trying to sell the value proposition to non-medical people is very difficult.
Yeah. You know, one of the things too that I'm sure that there's some that may not realize is that ergonomics covers not just the physical things that we see, you know, the musculoskeletal types of injuries there, but it can also cover everything that has to do with your workplace. You know, and Dr. You may have some others to add to this, but everything from lighting to, you know, protecting sound, you know, in your workplaces. So that has an impact on your hearing. I don't know, can you think of some others that would be there as well?
Office settings have become, huge. So it can be everything from even prolonged sitting where we think about it as kind of like a risk for your overall health, but I think it's also a risk for your productivity too. If we've all kind of sat too long in our chairs, and once we realize we've been sitting for an hour, 2 hours, 3 hours, and we stand up, we realize how kind of dormant our body has gotten. And I think that affects our cognitive ability too, as well as our well-being. And so really it takes a holistic approach to look at everything. And it almost needs to be kind of a top-down approach where leadership is saying, let's focus on this, but it needs to be a grassroots effort to where people need to be part of that kind of investigation of what is needed,
Corey had mentioned that he had said that slips, trips, and falls, as well as sprains and strains, are very significant injuries for their organization. He said he's in residential new construction. Thank you for that, Corey. I think a lot of others on our event here today would agree, and definitely we see a lot of sprain and strain injuries too. That's the number one type of injury that we're seeing too. So definitely we understand there. Dr. Marley, before I come to you, let's talk about, has the organization adopted any, have you started to bring in any ergonomic practices that are there? So have you developed a program? Have you thought about developing a program? Where do you stand there within your specific organization? And while he's doing that, while you guys are doing that, then I'm gonna have Dr. Marley actually talk about some of the modern approaches, that gets away from the old way of thinking about ergonomics and looking at how do we look at things now, or how should we be looking at things now. That varies.
Yeah, and so exactly, just with the evolution of everything and just learning more about it and understanding the significance of it, the first step is always to be proactive, right? So we've started to realize that these injuries were going on in the workplace, affecting our employees, regardless of what their job may be, whether it's a little bit more active or sedentary. So again, just integrating those ergonomics into the initial workplace design to help prevent those injuries. And then with the usage of technology, utilizing the technology just to continue to monitor kind of what's going on. There's various different softwares where we can kind of take pictures and check the angles of how people may be sitting to help improve their posture, things of that nature, and utilizing just AI and just the technology that's been advancing. But first and foremost, initial thing that we normally see is just utilizing that adjustable furniture. Sometimes that could make the biggest difference. That allows you to personalize the workspace for any and everybody. So the way I like to think of it and explain that is just like if you were going to sit in the car, everyone's different. Some people are bigger, smaller, shorter, taller. So when you get in the car after Shaquille O'Neal, I'm sure you're going to have to pull that seat up, kind of adjust the steering wheel, adjust the mirrors in order for you to safely navigate that car and utilize that car. So by using these adjustable furnitures, that allows us to personalize that workspace for that individual, especially, for example, between AM and PM. They might have a difference within their mechanics and or just their needs. So that saves the company and that also saves the employee time, money, and energy, right? And also just having that holistic approach. And by that, I mean, not just what's affecting them physically, but also mentally as well. The mental aspect is the huge part. If they think that things are unsafe, or if they think that they're going to hurt, or if they just have that negative mindset cognitively, that shows, the research shows that they're more likely to actually happen. They're more than likely going to get hurt, or something's going to feel funny to them. So we have to show them that we're buying into it, so they feel as though they're buying into it. Things are safer, things are better, and they can have those concerns that are addressed.
Mm-hmm. Dr. Marley, we've had some questions and some comments that have came in. David was asking what your thoughts are on the use of the standing desk and said that he'd read that they are actually bad over time. What are your thoughts?
Yeah, so that stuff isn't always one size fits all. I would always say kind of giving them the option to kind of decide. Definitely sometimes it's not the best, especially depending on how they're standing or where they're standing. If they're standing on hard concrete floors all day, then yeah, their lower back, their knees, hips, things like that are going to feel some of that wear and some of that pressure, but definitely kind of alternating maybe between sitting and standing would be good. And again, that's a perfect example of why that adjustable furniture is good. So for example, for an hour, they might decide that they want to stand up, just kind of get the body moving and kind of warm them up. And then later, after kind of doing some more strenuous activities, they might want to sit down. But yeah, I definitely think that just like anything, there's pros and cons to those standing desks. But obviously, if they're utilizing them, we want to make sure that their rest of their mechanics and just their posture is good, or else it won't do any good to them and it'll do more harm.
Mm-hmm. The other question I was going to ask you about was, we throw the term around AI and how AI can make such a difference, et cetera. Specifically, can you tell us what type of technology is being utilized in some of these? When we say AI, are we talking about monitoring? Is it like something that's self-worn? I think we may be getting into this one in the next one, but are you talking about watching something that watches what their posture is, or watching their movements and giving you that feedback that way that you're aware of what, how they're actually moving throughout their day?
Yeah, so for sure. So there are apps that can be used, or different softwares that can be used to where you can record or capture pictures of certain employees while they're completing tasks. So for example, one thing that I do with my company is that I'll go through kind of based off of what the individual company wants as well, kind of seeing what jobs are quote unquote high risk, and kind of just recording their employees doing that job, taking pictures. And what the software does is it will kind of look at their spine, see if they're twisting, see how they're bending, kind of mark and kind of show where there's being extra strain or stress based off of just their mechanics and what's captured within that picture. There's also stuff that you can wear that can track it that way as well. But obviously, not everyone finds that comfortable. And kind of it could be very costly going between people, and obviously wanting to cut down on any contamination. That's definitely things that I've utilized while working with collegiate athletes and even some high school athletes. Kind of when they're lifting or when they're doing certain exercises, that kind of help show how they're standing. For example, different force plates, if they're leaning to one side, if they're not utilizing the other side, things of that nature as well.
Mm-hmm. Some additional questions that came in. One was asking, Zenith said, I work remote and have a standing desk. How long would you recommend standing and how frequent?
So that stuff would be more based off of a bigger picture, right? So kind of seeing how that standing desk is set up in the rest of that work area. For example, with one of the contracts that I work now, there are some people that stand for about 20 to 45 minutes. And after that, they kind of need to take a break. So I always say, listen to your body. If you're sitting down and you start to feel that your back is getting a little tighter, maybe you want to stand up. But when you're standing up, again, it also matters where you are and what you're standing on. If you're standing on a little plusher surface that's kind of more forgiving, maybe you could stand a little bit longer. But in factories and things where I am, normally we try to get a nice mat for everybody, but if they don't have a mat, maybe they can't tolerate that standing for that long period of time. And also it comes back down to the individual and kind of just their past medical history, whether they've had any surgical procedures, hip replacement, knee replacements, things of that nature. So unfortunately, that's a tough question to answer right away without kind of knowing the background of you and everything that you have going on. But I would always say, listen to the body.
Mm-hmm. I think that we've opened up a can of worms. There's lots of questions that are coming for you, Dr. Marley. Bob was asking about stretching at work and what the best approach is. You know, we always hear about organizations that have these stretching programs, but then, you know, it's like, is this really making an impact? And you know, is it just the stretching alone, or is it the stretching in addition to additional practices that are taking place that have that impact?
Yeah, so I think stretching definitely makes a huge difference. You know, I hate to admit it, but I'm getting older, right? So maybe when I was younger in high school and I was going to play sports, like, I don't need to stretch. I'm still young. I can do it. But now I tell you, if I go out there and I do something strenuous, I'm getting hurt. I have a 7-year-old daughter, so just chasing her around and playing sports with her, if I don't stretch, I feel it, and she make sure that she lets me know, right? So as our population is getting older, that stretching is definitely needed. It's very key. I've worked with several companies where I've helped them implement pre-shift stretching. And, you know, you obviously don't want it to be something that is very long and tedious because you want your employees to be compliant, right? You want them to follow through with it. So making them simple enough to where they can do it prior to their shift and even during their shift, and something that they can do after their shift to help cut down on any soreness or things like that they might be feeling. But the research definitely shows that stretching helps cut down on these injuries, these musculoskeletal injuries, these different sprains and strains. Yeah.
Also, Tom had a really good point. He had said that within their facility, that some of the biggest concerns come from their engineers not taking into consideration the ergonomic effects when they're designing equipment. And so they have, well, after the fact, then, you know, it doesn't have as much of an impact there. It doesn't prevent injuries. So do you ever, I would assume that there's others that have that same challenge within our organization. Do you ever see that there's organizations that will bring you in the very beginning before they start designing some of those facilities to get your input or make it to put a greater focus on ergonomics, I guess I should say?
Yeah, so I've seen both ends. And normally those that bring me in the beginning are much happier because you're able to kind of catch those different things that those engineers might not be taking into consideration. For example, I've had one company kind of call me in after they put in a new line where they spent millions of dollars. And then they started to see a lot of their employees were complaining of different pains. And then when I looked at it off the bat, I was just like, hey, like that packing table is way too low. And so they're kind of hunched over. And so that was a very expensive problem and very expensive fix. But Also, obviously, if I'm brought in sooner, or if you get some look at it sooner, you're able to kind of catch those different things, right? Able to kind of make sure that see if we're able to get something that's more adjustable, more forgiving, in order to again be personalized to those employees that are using it at that time, and kind of just coming up with the best practice of how to utilize it, maybe how you're staggering these employees or things of that nature.
Mm-hmm. Let's see, we had some more that came in. Kyle was asking, along with stretching, what are your thoughts on cracking your own back and neck?
So that stuff is tricky. I would always say to get a medical professional. No, a lot of people still do it, but again, you never know what underlying things are going on. Um, for example, I don't know if you've been to a chiropractor, but normally they should test for a ligament, your alar ligament, to make sure that if you crack your neck, that you're not going to cause any other significant injuries to your brain stem or spinal cord or things of that nature. So I would not advise to just crack your neck or back, because again, you never know what's fully going on. So definitely getting a medical professional to help you with that.
Okay. And then Joe was asking, what do you think about treadmills for workplaces? Is this just another fad like the large exercise balls that everyone loved until they didn't? I remember those exercise balls.
Mm-hmm. Yeah.
Yeah.
Yeah. So again, like there's always those fads, but just seeing what works best for that or for your environment itself, right? Um, I'm not the biggest fan of them because I think that just could potentially open up another safety concern, me personally. But again, everywhere is a little bit different. And it would really just come down to kind of what your purpose is, what's your goal of implementing those treadmills, and seeing if that aligns with your safety goals as well.
Okay. All right. I'm going to ask you one more question, then we'll let you move on, and we'll come back to some of these that are here. But Tim had said, as an athletic trainer, I used a lot of ballistic stretching with athletes. Now in occupational safety, do you feel like workers should be open to dynamic stretching as well?
So the dynamic portion, again, as a sports medicine physical therapist, I love ballistic stretching as well. But it's, to me, I noticed that it's a little bit more difficult to implement within the workspace just because of the space that we have, of the restrictions that we have, right? Unfortunately, I know you've probably seen as an athletic trainer, you're on the field, you have a lot of space to spread those athletes out. But normally here or within whatever setting that we are work-wise, we don't have that. And also there's a lot of those underlying ailments, especially again, with that aging population, and just different concerns, whether vertigo, different dizziness, balance issues, right? So me personally, I think the static stretching is best. You can always obviously educate those different employees that might be younger, a little bit more athletic, on different dynamic stretches. But as far as within the workplace, I've had one place that we're doing the quad stretching, where they're standing up and they're pulling one leg behind their back to get that stretch in the front of their thigh. And employee actually fell and broke their hip while doing it, right? Yes. So just to be on the safe side, I always stick with 2 legs down, very simple static stretches.
Mm-hmm. All right, and I see all of your other questions. We definitely will circle back to those. So we haven't forgotten about you. But talk to us then about the importance of developing a comprehensive plan. You know, why is it necessary? Why is it such a big deal?
So it's a huge deal to have a comprehensive plan, just because, for example, just with the stretching, if there's not a plan, if there's no commitment from leadership, from those underneath, then we're really not going to have that change. We're not going to see that change in culture, right? So we definitely need that strategic planning, to where we are integrating these different ergonomic findings into the organizational culture, and kind of just changing that policy, right? because you can give them different things to do, but if we're not making it a policy, if we're not making these things mandatory, then are they going to take that time to really care, right? So finding that way to get that follow through, making sure that leadership, that we're securing the executive support for these successful implementations of whatever your company is deciding to do and implement. This will get back down to that employee involvement. And once those things are changing, we see more carry through from the employees. But we also want the employees to be engaged within these different things, right? So we want the staff to help identify these different risks and different solutions to these risks, because they're the ones interacting with these machines or within their environment the most. So yes, we can look on the outside looking in, but one thing I personally do is, if this is a high risk area, if I know Holly's in a high risk area, I'm going to go and I'm going to talk to Holly. Hey, Holly, so what are you seeing? What are you feeling? What's your day normally like? And getting her input. That'll not only make her more, or that'll not only just make her happy, but if we come up with this solution, she's more likely to follow through, and she's more likely to do it and listen to it because she feels as though she was part of that solution, right? And also just having that continuous improvement. Just because we made an improvement last month, 2 months ago, last year, that doesn't mean that there's not more that we can do. We should always be kind of monitoring that, right? We always want to monitor whatever changes or improvements that we've made, just because, sometimes it's a fad, right? Sometimes it's one thing that's working really good for the time being, but maybe things need to be revamped, or maybe there's a little tweak that we can make, right? So always having those regular assessments and adapting that practice to constantly look at things, reassess things, and make sure that things are not only being followed, but things are still working as they should be for those employees and our staff.
Okay. So we've had some other questions that have came in for you. Joshua was asking how to approach situations where lifting and working off of pallets is a major part of the job, and the associates are not in the best shape and have limitations in bending and squatting. How can they lift safely if they can't bend and squat correctly? It's a great question.
Yeah, that's a great question. And again, one thing that I do and try to implement wherever I go are FCEs, so functional capacity evaluations. First and foremost, before you are hiring these individuals, yes, we all need help, but we want to make sure that we're putting not just the company, but that individual in the best position to succeed and succeed safely. So if they're not able to do something or complete their job description, while I'm completing that functional capacity evaluation, I would be able to see that, and we'll kind of mark that. We'll know, like, hey, this isn't a good job for this person because they don't have the movements necessary, the power, the strength necessary in order to complete this job safely. So that's definitely the best way, in my personal opinion. Sending out after you probably extend an offer to somebody, have it contingent upon passing that functional capacity evaluation. What else was there? And then again, always lifting safely. Unfortunately, there aren't really ways around that, around the proper mechanics of lifting safely. We always want that neutral spine lift. But again, maybe assessing that area and kind of seeing maybe, again, using those new pallet positioners that are keeping things within that that power zone, right? So it's waist height or higher to where employees can easily get it. For example, if they're not able to squat down low to the floor, keeping things up a little higher.
Mm-hmm. Let's see, Rodney was asking, is there anything that can be done with repetitive motion in regards to injury prevention?
Yeah, so there's a lot that can be done, right? So different stretching, especially with those repetitive motions. A lot of people, I don't know exactly where everyone is working, but I know we've probably seen people with those bands kind of around their elbow area from those overuse injuries from that repetitive motion and or seeing people with carpal tunnel, right? So again, just that proper education is always the first step. So educating the employees on different stretching, different symptoms to kind of look for, just different things prior to them being in that environment, and letting them know, like, hey, I know you might be right-handed, but if you're constantly turning something with your right hand and that's the only hand that you're using for an 8-hour shift, 4, 5, 6, 7 days a week, you're gonna get those repetitive injuries. So educating them on the importance of utilizing both hands. And again, coming down from leadership, talking to leadership and letting leadership know how important it is to have different rotation schedules, right? So instead of this one person sitting there for hours at a time, maybe this is an area where, you might work for 30 minutes and then there's another low risk area where you might go and you'll spend that 30 minutes there, and kind of going back and forth or whatever rotation schedule works best for that environment.
Okay. Speaking of rotation, Brad had said, I work in the poultry processing business where repetitive motion is a concern. It is hard to rotate employees because they are trained in one process. We could rotate somewhat, but they would be using the same repetitive motion. What else can we do to help these employees?
So again, that would be something that I'd have to look into a little deeper, kind of just like what your company's process is altogether, and kind of, again, talking to the employees, talking to the leadership staff, and kind of just seeing what there is. But, like I've been to some places to where they might have people that are cross-trained in like a relief position. So maybe that's something that is possible, right? Because if they're just in one area where they're doing something repetitively and then going to another area where they're going to pretty much be doing the same thing, unfortunately, that rotation isn't going to really bring much of any benefit, right? So kind of just talking to the team and kind of putting our heads together to kind of see and come up with a different design potentially. But that would definitely be something that's a little bit more in depth and more specific, and definitely need some more information on that. But we can definitely talk about that and kind of figure out any solutions.
Okay. Dara, coming to you with a question. We've talked about the preventative approach, obviously, with the functional capacity exams, as Dr. Marley had mentioned, so that you're hiring the right people. You're not bringing people in that can't perform those duties. But going back to your HR background, what do you do with the employees if you find that they can't perform that duty once they're already there?
That is a really complicated question, and it is something, like Dr. Marley said, you've got to start with policy and practice. And then when you think about aging workforces, this has been a challenge for a lot of companies, especially as they progress. If you have employees that have been able to perform a job for years, and then you institute a new policy and practice around functional capacity exams to try to prevent future injuries. And then companies are faced with, what do we do with our existing employee base? And what if an employee who's been with the company for 40 years can no longer perform a job? And so when you look at jobs and you look at job descriptions, you have to kind of go all the way. And I think that's why when we think about policy and bringing departments together for this, it is really critical to do a full evaluation of all job duties, making sure that job descriptions are reflective of everybody's current job duties. If anybody is in a current role that they are struggling with, where they can't perform a job duty for some reason, looking at either changing job duties, making sure that you can accommodate them in any changes and work through any of those challenges. I do not recommend terminating any employees that can't perform job duties, but of course I'm not your HR legal team. So that's why you work with these different functions to make sure you have an approach, because as you roll into these approaches, these types of questions do come up, and you need a plan for how to support employees, make sure employees are able to perform the jobs they've been tasked with and are not getting injured or disabled on a job duty that maybe they used to be able to perform and no longer can. And so there's a lot of these things that come up when you are instituting programs such as this. So make sure you're working with your teams to implement correctly.
Yeah. Dr. Marley, talk us through some of the case studies that we had pulled that had some success with some of the programs that that they had implemented.
Yes, for sure. So Goodyear Tire and Rubber. During their case study, they saw an 82% reduction in their MSD, so their musculoskeletal disorders, those different injuries. So they were faced with a high MSD rate across their 50 plus global locations, and they needed a way to, again, like Dara said, a cohesive way to kind of come together and assess and reduce these ergonomic risk. And so, again, it's not always just one person. It takes a team, right? Everybody needs to kind of come together, kind of assess what's going on, understand what's going on, and kind of bounce those ideas off of one another. So their solution was they adopted different industrial ergonomic software for real-time AI-driven risk assessments, used online training in various different languages, just, again, for those employees that might not have English or even Spanish as their primary language of speaking, right? So whatever they can understand, just having those various different languages and those online trainings, and the employee and local employee involvement in the program design. Again, by having those employees, that probably helped increase just that compliance and that buy-in from their employees. And all that together empower the plant team to create and tailored ergonomic improvements. And again, by having all that, they were able to have that 82% reduction within these injuries and continue to push toward eliminating all high-risk jobs by 2028 with consistent employee engagement and best practice sharing.
Wow.
So again, just sharing within one another, right? Like to say, not everybody knows everything, regardless of how long you've been doing something. There's always something new. There's always something that you can learn. And again, learning and listening to those people that are within those positions the most, because again, they're the ones that are going to have to do it. So you have to listen to them in order to get that buy-in and to see this great reduction within those injuries.
Mm-hmm. So it's really using all the different types then. So it's really that holistic approach, like Dr. Sherry had mentioned then, on using the various different, the AI, the education, the employee involvement, et cetera.
Yes, definitely, 100%.
Yeah.
And then another great case study was with Diecast. They were facing challenges with high absenteeism, turnover, and workers' compensation claims. There was a small manufacturing plant with repetitive, high-strain tasks. So again, with stuff like that, those are a lot of red flags, and those are a lot of concerns that or that this company wanted to fix. So their solution was investing a lot of money within their ergonomic and automation improvements. So going a little bit more machine-based, right? So they invested almost $500,000, including different loading systems, packing stations, and again, just automating things to help decrease the risk of injuries to those individuals and allowing those machines to do a lot of that heavy labor, right? So these changes were implemented by the maintenance team with minimal resources, but their outcomes, they had a 54% productivity increase, 93% reduction of workers' compensation claims, and an annual savings of $1.9 million. So to me, that sounds perfect, right? That sounds like you're saving a lot of money, but you're also helping your employees, right? You're getting your employees buy-in. They're a lot more productive because they probably feel safer, more comfortable within that work area. Excuse me. And also, again, by automating certain things, you're decreasing some of that strenuous, repetitive tasks that now some of that hard work is being put onto the computer system or onto those machines, right? And again, reducing that workers' compensation claims and those injuries. I'm sure from a HR standpoint, they probably love that number, because if people aren't getting hurt and you're showing your employees that you care about them, that should decrease that people being absent, people calling out, people quitting because they don't feel as though they're being broken down by that job, right? So again, helping those people, helping your workers and your staff stay healthy and showing that you're investing in their well-being overall will definitely help with a lot of things in the future, as we saw with diecast.
Absolutely. So they actually brought in some machinery then to help with some of the duties then that the workers were previously performing individually, and that really contributed to the results then. Is that
yes, for
okay.
sure. Like even just personally, like I've worked with the Fortune 500 bakery, to where again we've implemented those different automated systems instead of hand scaling, just that repetitive motion where they're scaling all day or for hours a day. Now things are automated, right? Now you can just kind of place the bucket. You can obviously still need to know the recipe, right? But you can utilize that machine system more to help decrease that constant repetitive motion. We've seen a huge decrease in just the worker comp claims and also those repetitive injuries and carpal tunnels, things like that. Yeah.
Okay. Well, before we go to Dara, we'll show you kind of the results from what you guys had said that you currently have going on in terms of adopting some ergonomic solutions. So it looks like that almost half of you have said that yes, that you have adopted at least some sort of solution to be able to help your employees in that way. And I also was really encouraged to see the nearly 24% that said they were planning to as well. So that's extremely encouraging in terms of thinking about this from the big picture and recognizing that there's some challenges here and that there's some improvements that we can definitely make to impact the injury outcomes there. Dara, we talked a lot about how it is that, we talked about the investing some money and how it is that you can actually get that money from those that are higher above. So talk to us about what some of those strategies are, how can you present that information and those that would be making the decisions or writing the checks, and they would be willing to make that investment.
Great, thank you. And I think Dr. Marley shared a lot of this too, as we talked through this, making sure that you get that stakeholder alignment is really important. I think Dr. Marley said this, and I think it's something that we say a lot at Axiom too, which is that cultural shift in the way you approach these programs is really important. We've seen this in any sort of program adoption or change management process, that if you don't get stakeholder buy-in and really leadership buy-in from the top down, it is really difficult to make lasting change within an organization. You might be able to influence change and make change, but to really change an organization and the approach you take, you need that CEO all the way down to every bit of leadership buy-in. And that's what will drive real change within organizations when you shift into these types of programs. There's a lot of, like we said, a lot of policy changes, a lot of practice changes that have to happen to shift into a successful program. And that is going to take everything from safety, risk, HR, legal, operations. Everybody needs to be aligned with what this program and the outcomes of the program the team is looking for. So if you do this well, there will be a demonstrated ROI, which is obviously the end product of all of this. And these case studies that Dr. Marley talked about and looking to your peers to find some of those case studies, I think is a great suggestion, because you can see where successful implementation of these types of programs have occurred, and then build something similar within your organization. So I know there's been a lot of questions around how to implement some of this and think about it from the pre-employment perspective all the way through return to work and making sure you're supporting the employees through that process. So it is an investment. Holly said it is a financial investment, but there is a way to demonstrate ROI through that process. And so it'll take building that that engagement within the stakeholders, and then implementing through an outcome-based approach to an ROI. Sorry, Holly, I think I cut you off.
Yeah. So would you say then that whenever you're putting your plan together, would you maybe identify, would you do it in phases? Would you split it up to where you would identify one area that maybe would be high risk and maybe start there so that they could immediately see where this is making an impact, or what would you recommend?
Well, I might put it over to the docs, but I know that when Dr. Cherry and I have looked at doing this, we bucketed risk based on job duties. And so when you look at people's job descriptions, while I think sometimes there's a lot of little tweaks and nuances to people's job descriptions, you can bucket them in high risk, medium risk, low risk, and start there as the very beginning of something like this. Let's start with that high risk population. What can we do to affect change within that high risk population, and then go from there in building your programs. But Dr. Cherry, Dr. Marley, anything else you would implement there?
Yeah, I would just add on to what you were saying, because when you're thinking about doing, functional capacity evaluations across a diverse type of workforce, job category wise, you can sometimes work with leadership supervisors to see if you can kind of bucket them into, similar exposure groups, things like that. Department of Labor has really good categories of heavy work, like moderate, sedentary, very heavy. Some of the questions I've seen too is, how to kind of clear people, or, I think there's frameworks, there's layers to it. There's kind of a quick way to view it as, starting out with just if someone's out of work for a certain period of time, having their own doctor return them to work. Then you could have your own kind of return to work exam. You could have all of those plus a functional capacity evaluation. So there's kind of layers to it. And, in many ways, I would say at least have their own doctor clear them to return to work. That's some level of clearance. Obviously, the doctor can be the advocate only for the patient sometimes. So you can go down that pathway, but that's kind of how I've seen it, from doing nothing to doing almost everything you can.
Mm-hmm. Bob had mentioned in terms of when we were talking about ROI and how it is that you can present that. He had a great comment. He said that that they use the ROI cost justification, and they will use the cost avoidance data. So the average cost of a strain injury, compared that with the internal cost data, and then the external data. It said it's not perfect, but it definitely helps. So I think that, thank you for that recommendation, Bob. I think that whenever you're looking at the numbers, that definitely is a great strategy to start out with.
Yeah, I really appreciated Bob's comment there. We look at the National Safety Council and Department of Labor both have great data around average cost of sprain strains, and I think over the last couple of years, it's been $33,000 to $34,000 per sprain strain to an organization. And so if you're looking at an ROI, starting there is a great place to start. If you can avoid one sprain strain, that's a $33,000 potential claim that you might be avoiding.
Mm-hmm. Yeah. I'll let you guys review the key takeaways so that we can kind of get to just a few more questions before we have to wrap up. Dr. Marley, Zena was asking, she had said, we have field technicians that require lifting up to 50 pounds, carrying ladders, but she had said that they also see the older employees being extra careful. Let's see, there was another one that was on here that I was going to send your way. I think it was specifically the one that was asking about, were there any types of apps or wearables that you've seen or that you recommend or that you've incorporated into any ergonomic plans that you've been involved with?
Yeah, so with the first one, just with seeing the older employees being extra careful, like there's obviously nothing wrong with them being extra careful, right? But I guess it comes down to why, or kind of exactly what you're seeing, right? Still making sure that they are able to complete that task or kind of move that equipment and move it carefully, right? But again, that would kind of come back down more so of like a HR matter, and kind of making sure that you have those ADA compliant job descriptions, and that people are able to complete those tasks and also complete it in that in the timely manner in which it needs to be completed, right? So maybe it's just something that maybe they need a longer window or a longer period to complete that task if that's possible. But again, just seeing what is necessary for that task in those individuals. As far as the wearables, there's nothing particularly or one specific brand that I would suggest. I think there's many different brands. With my time just at a couple of different colleges, I've probably seen several. So, and sometimes even just the different sport teams, they might use a different brand as well. So it kind of just, again, comes back down to budgeting exactly what you want to track, as well as who's utilizing it and kind of what they're most comfortable with and kind of what's most comfortable to those that are wearing it.
Absolutely. Well, thank you for that. Well, we've reached our limit here, and I know that we still have a few questions, so we may be following up with a few of you on those. But I appreciate all of you attending. You've been extremely engaging, asked some great questions, and I think that they not only help you, but also help some of the other colleagues as well. And then I also appreciate our speakers that have came in and shared their expertise as well. We appreciate you. So if you haven't already, make for sure that you click that register now button, that RSVP, so that we can see you next month when we talk about OSHA recordability, when we talk about the record keeping, and we will let you go for today. Thank you again for joining. We look forward to seeing you next month.